there should be equality in healthcare worldwide. There isn't equality in healthcare worldwide. If you're a child that's born in a country where you don't have the facilities in what's so-called developing country, low to middle income country, you might not have access to the treatment that you need, whether that's a life-saving treatment. So Chain of Hope was originally born out of France, actually, and they started bringing children, La Chaîne de l'Espoir, and they started bringing children to Europe from African countries predominantly. And they approached my founder, Sir Magdi Yacoub, who was a world pioneering heart surgeon, to see if he wanted to set it up in the UK in 1996. And he was already doing a lot of humanitarian work. And guess where he was already helping? Jamaica from the 1960s with Michael Wooming, Professor Howard Spencer. So he had, as an Egyptian surgeon that had become very famous in the West and built the biggest world's heart transplant centre, he had a love affair with Jamaica. And so the first destination that Chain of Hope UK, when it was established in 1996, the first destination was Jamaica to support the surgeons at the University Hospital here in Jamaica with their programme. And he mobilised the teams to go over, to come down, bringing equipment that was much needed and very expensive, and equipment still is today. That's something that hasn't changed. It's more expensive in the Caribbean than it is, up in Europe.
Inclusive of drugs and stuff. Drugs as well.
Everything. And I guess that's an island situation. So that's a challenge today. So we would bring down the consumables. So cardiac surgery is expensive, and it's a tertiary care. So what you have, very relevant to Bustamante actually, but I wouldn't want to get too much into the politics. So Bustamante is a hospital that has many different excellent disciplines, but most of it is, accident and emergency, orthopedics, there's a certain level of care. Cardiac is another specialist level of care. So the doctors have to do specialist training. One of the things I'm quite proud of is that we developed the first ever paediatric cardiac training module for nursing in Jamaica with the Ministry of Health 10 years ago. And it was a cardiac module that was added on to the ICU school at the Ministry of Health, so that when nurses were going through the ICU training, they then did a cardiac module. If you can resuscitate a paediatric cardiac patient and you've had that training, it brings up the standard across the hospital generally. So it's a little bit of like eye surgery, paediatric cardiac surgery. It's a higher level of care and specialism.
It's an add-on value.
Yes. Yeah. So if you train the staff in something specialist, you're raising the standard across the hospital. So I think that's something that we advocate for all the time. There are those across the world, not just in Jamaica, that believe, cardiac surgery is very expensive. So therefore, if we're in a low to middle income country, we can't afford to invest in that. But we're here as a cardiac charity, and we believe that the life of every child is important. Well, it may be expensive, but if your daughter's born with a hole in her heart, does that say you leave her to die because it's expensive? No, sir. So we believe it's extremely important to provide this care. We have specialists that are willing to volunteer and give their time. We've been bringing them to the island for 20 years. We've done over 65 missions, trips of bringing specialists down, and we will continue to treat those children. But what we really want and what we advocate for is a Jamaican paediatric cardiac services that is locally run, locally managed, locally funded eventually, hopefully, with government funding. So that's the lobbying part of what we do, because currently most of the consumables, cardiac consumables, are still coming in from outside. There has been a change that the hospital has started purchasing some of the cardiac consumables, so we're seeing an evolution, and the hospital has embraced the cardiac program because there's a population of children out there that need cardiac care.
How young do you get?
From newborn, neonates, right through to, there's a big boy, you'll see him downstairs, I don't know his age, but he's quite a large, is he 14?
Yeah, 14.
So he's actually over the age of Bustamante, but we believe that children are children until the age of 16, and it's really important that we take care of them. And adolescents, because he actually had rheumatic heart disease, which is still here, but again, another development in Jamaica is your rheumatic disease has gone down, so we must congratulate the Ministry of Health for that, because they're obviously doing something right on the primary care level. catching it earlier on, but that's an acquired heart disease. What we mainly deal with is congenital heart disease. So 1 in 100 children anywhere around the world are born with a congenital heart disease.
1 in 100?
1 in 100.
Yes.
In fact, my grandson this year was born with a hole in his heart, would you believe? So I went through it myself, up in London. You know, so it happens to anyone, but up in London, it's dealt with routinely as a matter of course. And we believe, the philosophy of change paper said earlier, that should be worldwide. You shouldn't suffer through where you're born.
How do you prioritize? Is it based on age, severity, or complexity of the need?
Yeah, it's a really good question. We don't tend to prioritize. We believe that we are serving and supporting the Jamaican team.
Yeah.
So you have a very good cardiac surgeon here, Dr. Sherrod Little. You have cardiologists, and they're the ones who see the patients and the need on the ground. And they select. So I think that's important to say, that we don't come in and take over and select. That's the job of the Jamaican doctors, who have been trained through the program over the years. And they're selecting cases on the need that there's need, and there sometimes, sadly, the complexity can be too complex to be able to tackle locally here. So sometimes we fly those children. We're going to see children tomorrow that are coming back, that we've flown to England, we've flown to Europe, that Chain of Hope has funded around the world for complexity. Or if we feel that they can be operated on here with the resources that are here, and that doesn't just mean like the surgeon, he may be able to do the operation, but we need the intensive care resources. There may not be enough nurses, which is a worldwide problem with a shortage of nurses, or a lack of ICU space used to be the problem in the past, which was why at Bustamante originally the ICU space was a bottleneck for cardiac patients to get treated, and we saw many that were dying and were not getting the treatment. Through developing this building together with different partners, we have, you can see it in a minute, a dedicated cardiac ICU for the children of Jamaica in this building. It's still not enough, but it's a massive step forward. So in terms of achievements and something that we can be proud of. We always see what the need is, but it's always good to recognise where we've come from as well, because there are children that are getting the treatment now because of this building. And that's really thanks to Digicel, put the cells first in the ring, Shaggy and Friends, which don't get enough credit because they put in $700,000 into this building. He knows why I'm saying that. Well, because it's not publicised.
Yes.
It's not publicised. And you know, that was 2 concerts worth that came into, and we'll show you the state-of-the-art catheter lab that helped buy. And with their money and money from Rotary International and an organisation called Gift of Life out of New York, we created the cath lab. Cath lab is a facility where the cardiologist can treat children, forgive me if I'm telling you what you know, but where we can treat children without having to saw open their chest, being graphic. But again, I go back to you, if it's your child or grandchild, if you can close a hole in the heart without having to saw open the chest, you'd rather it's that. So it's also about giving quality of care, coming back to equality of care, that we only want to deliver the best care to Jamaica. Again, we don't just bring any surgeon, we bring the top surgeons. Professor Sang, who is operating today on a very complex case, high-risk case this morning, he's from Great Ormond Street. I'd say he's one of the top surgeons in the world. So we bring different surgeons from around the world, not just from the UK, by the way, from Norway, Denmark. We bring you team members from Canada, America, Guyana, even nurses from Guyana, Grenada we've done before. So it's an international effort to work together. Fits in with the out of many one I like. And we, you know, I always say we could be based on an island. We don't need to be based, actually, we just happen to be based in London. But the boy downstairs he had rheumatic heart disease, referring to him, and you'll see him. Rheumatic heart disease normally requires that it eats at the valves, so the heart valves need replacing. So we brought a valve with us, but the skill of the surgeon that we brought is very unique. He managed to repair that boy's valve without us putting in the replacement. So it's really important to us that we bring you the A team. Someone else said it's the NBA stars of cardiac surgery. And I think that's our philosophy. It's quality, it's quality, it's quality. We don't just bring anyone down. We don't bring people from overseas to train them. She knows what I'm talking about.
Yes.
And it's really important that we are quality of healthcare and giving the best to Jamaica, because we feel passionately about that.
In light of that, the cases that need to be worked on, do you come in cold, or are you sent a preview? You're given a preview and that kind of thing, and so you can get a sense of where you're coming into. Tell me about that.
So we have Zoom meetings, which Nola organises between our team in England or wherever and Jamaica, don't we, beforehand?
Yes, definitely. So we have patient review meetings. So especially before a mission, weeks before, we would go through, after the initial list is selected, we go through and identify those patients, and we discuss, the complications, what equipment would be needed, any disposables that are needed, and then the surgeon, the volunteer surgeon from overseas, wherever in the world, would make recommendations as to what additional pieces of equipment or disposables we would need. There are times when they have to recommend, we have to get more things. And usually Chain of Hope UK would respond by getting those additional pieces of equipment for us or disposable items for us. So yes, the review meetings happen on a regular basis, and usually you have follow-ups too. So you may have a first and a second and a third meeting if necessary.
Well, tell me what happens with the parents of these children. My child is deathly ill. I'm poor, can't afford it. Sometimes even explaining the name of it.
Right.
Tell me about what happens here between the doctors or between yourself
and
the parents and the parents.
Right. Okay. So the children would have been seen in the cardiology clinics, right? And they would have been monitored on a regular basis. And then the cardiologist, the consultant cardiologist, will determine that this child needs to have whether a catheterization, Emma talked about the cath lab, or it could be a surgery that they actually need. And so the consultant cardiologist recommend that this child have this particular procedure done. So, and then you'd have the patient counseling. So you'd have a period of patient counseling. The parents are brought in, sometimes it's one or two parents are brought in, and then they are taken through almost like just to prepare them for what is accepted, what is going to happen rather, the risks that are involved, and to ask them if they are willing to take those risks, right? They do sign, documentation to say that they are agreeing to proceed with this procedure. Very often, some of them get cold feet and actually, say at the last minute.
We had it the other day.
Yeah, we had it the other day where the parent actually said yes at first to the consultant, and then later on she said, no, I'm really so fearful, I won't proceed. So you have to understand that they are given that option. They choose whether to go ahead, having heard all the risks and all of what it takes, and also the benefits, because they are going to be told this is what will happen to your child, or this is the improvement that you will see in your child, so they all of that is told to them ahead of time in one of those clinics, especially at the decision-making clinic when they actually decide, and then now they are referred to Chain of Hope. They would be placed on this list. After, when it comes, that list comes to the cardiothoracic surgeon. So that team looks at the list and would say to Chain of Hope, these are the children that we're recommending for the next because of how critical the case is. Or, so you ask the question, how do you prioritize? When the recommendation is made by the clinic, right, to come to the surgeon, then the surgeon will determine the severity of the case and decide, well, this is a critical case that needs to be done within X time, and then put that child forward. So this is how the decisions are made. It's based on the severity of the case and whether there is a time issue, if it has to be done within a particular time.
How much monitoring, tracking of the cases do you do for your purposes as well to learn how much of it happens and how does it work?
When you say tracking,
like if you do a surgery, how much you monitor that patient for how long?
Afterwards,
or
in the lead up to their surgery.
No. Afterwards, how much of that happens?
Oh, that happens at weekly clinics. So the child would come back, just like any doctor's visit. You'd be back in the hospital the following week after you are discharged, after a surgery, for example, or catheterization, you are coming in for a cardiology appointment, and then you are followed up now. So as the child heals, the consultant cardiologist will determine how frequently they need to come back. So it would move perhaps from every week to perhaps every month, and then maybe every 6 weeks.
Yes.
You know, so all of those decisions are taken by the doctor, by the cardiologist when they see the patients, and as the patient makes good progress.
We're talking about tomorrow's cases. When is surgery happening today?
It's happening now.
Okay,
It
yeah.
started from Monday.
Okay.
So
well,
at the
tell me
moment we have
about
three
what's
cases.
happening on this mission.
Sure. So this mission started, our team flew in, some of the team flew in on the weekend, and some of them flew in on Monday because the direct flights from British Airways from London happened to be on a Monday. So what we did is we flew in an ICU team on the weekend, because we send the ICU teams through the year all the time to support Dr. Little to do cases, because I come back to, they can do cases locally here, but sometimes they can't do a child because there's not enough nurses. So Monday was Dr. Little with our ICU team and the local ICU team working together to get the case done. Monday night, the big surgeon Victor Sang arrives with some other specialists from different hospitals around the world and start some more complex cases. This morning is the most complex case we have. So this is number 4 so far. So we would have liked to have been on number 5, but we had some challenges with getting blood, and a lot of the patients have fallen ill with flu and colds. So sometimes they have to. So we've had the cardiologists have had to ring and get other patients in. So the patients are prepped from the week before. It's all planned. One didn't want to come, as we said.
Yes.
You know, so these are some of the challenges. We want to do the maximum number of children this week safely, with the time that we have, but we want to do the maximum number of children. We want to have the maximum impact this week, don't we, with all the resources we brought all the equipment behind you.
What number are you aiming for? How many
10.
We wanted 10 children this week, So, but this is a big case this morning, and so, you know, it could end up that they may not do 2 cases today because this is a longer, bigger case, but they are planning to do 2 cases, but that's how it goes sometimes. We have to make sure we do it safely.
Speaking about the blood issue, how urgent is that? And use the opportunity to make an appeal.
Sure. So there is a problem. Sometimes there are shortage of blood at the blood bank. So we would normally have all the blood processed at the blood bank. So it's determined what type of blood the child has, and then a request will be made to the blood bank for blood. Sometimes there is not enough. So what we do to mitigate that is to, ahead of missions, we encourage, we do blood drives, and we try to do it along with the blood collection department as well. So we would encourage persons to go and give blood, any type of blood, because you don't know which child has what type of blood, right? So going back to now, just before the mission. So when those blood requests are made to the blood bank, then once it's approved, they said, yes, we do have for all these children, then in the early morning of the day of the surgery, those samples are collected. Now, when they are collected, anything that is taken off during the procedure is sent back to the blood bank for processing. And so we had to for missions, we actually had to get a dedicated bearer just to pick up that blood back and forth. So it has improved, but we do want to make an appeal to Jamaicans. If you are able, please give blood, donate blood. Just say you are donating it to Bustamante Hospital for Children, because on any given day, for any procedure, whether cardiac, orthopedics, or any other area, they will need blood. And so we encourage you as to give blood where you're able.
Professor Yacoub, our founder, when we used to come and do missions in the early years, our surgeons would give blood so the patients could be operated. You know, and so it's come a long way, but we still need the community in Jamaica and in Kingston to give blood to help the children so they can get their operation.
Have you been able to gauge the impact over the years? Have you met like patients 10 years after or anything like that, or 5 years after who were so at risk of not living to grow and they're now healthy?
Yes, I have met quite a few of them. We had an open day last year, and we had quite a few children there who were saying, well, the parents were saying, you know, my son was so-and-so, my son was so-and-so. I met one boy, And he was a big boy. He was 18 plus. And it just warmed my heart to see that child. And in fact, tomorrow, when we have that small ceremony, the thank you ceremony tomorrow, we will have children there who have been operated on, as Emma said, who are 22, now 22. Professor Sang had operated on them 20 years ago, and they will be back. So you can assume that there were two at the time of the operation. So they will be here. At least two of them will be 22. So we're looking forward to that.
And a little girl from St. Anne, Ashley. There's a few of them.
Quite a few of them coming back tomorrow.
You need to come back tomorrow.
Right, you need to come back tomorrow. We will have at least 12 of them here. And they are all age ranges from, as I said, 20 plus, coming all the way down to probably 12, 13. So they'll be here tomorrow.
And talking about the blood bank, it's funny enough, there's one lady called Katie Clark, and she was operated on by us, and she actually now works, I don't know if she still does, but she went on to work at the blood bank as an adult, and she was operated as a young child, and she reached out and found us. She reached out to me and found us because she was operated on by Professor Yacoub many years ago. In our early missions, and then she went into, she works in the blood bank, and she came up to England and spoke to some of the people that give us money to be able to do this work, and she and spoke to them after that, and helped encourage the fundraising in England. And we the fundraising is really important actually, because we wouldn't be able to do this without the generosity of the donors. And you know, we a lot of the funding comes from raising funds in the UK, but also in the States through Gift of Life International, and we're really trying to get Chain of Hope Jamaica off the ground through fundraising as well. So we set up the hospital in the south of Egypt for a neglected region, so all the services were in Cairo. You've got a population of 100 million, so very different to Jamaica. But in the south of Egypt, we set up a heart centre, the Aswan Heart Centre, and eventually it grew and grew and grew through donations locally, through the local charity, and they now treat over 3,000 patients a year there. So we're going to take the children from Gaza to the hospital in Aswan, which is the south of Egypt.
In where?
Aswan.
Yeah.
It's where old Nubia was. That might resonate more. And we're going to bring the children out of Gaza to there. So our philosophy, and we regularly bring children from Yemen there, from Iraq there, from African countries to Aswan. So we encourage, where I'm going with this, we encourage countries also, not just it's good to take care of your own population, but also children from outside. And we have in the past flown children to Bustamante from Trinidad, Grenada, and we hope in the future that the aim was essentially here was to create a hub in Jamaica for the English-speaking Caribbean, for islands where there are no facilities. So as I say, children from Grenada, where you've got a population of 100,000 only, you haven't got a big population there, and so it doesn't warrant setting up a whole paediatric cardiac program. So we saw Jamaica, that was the original vision, was to see Jamaica as a hub. We have a long way to go to get to that. I know everyone wants to help the Jamaican children first, but I think we should not forget humanity worldwide right now. I think it's really important to keep that aim going, that we want to bring in children from other islands, and that's what we would like to do, and maybe incorporate when we come down, a child from Grenada or a child from Haiti, which is another area.
On a personal note, what does it do to you both to see these children in this sad state? What does it do to you over the years to see these children time and again, even though they have happy endings? What does it do? Does it numb your senses or anything?
Well, you don't always have happy endings.
Okay.
And that's hard. What I would say is that hard. That is hard. And I don't know if you've been through that yet, but it's...
I have.
Yeah, and that's not easy. However, you've got to hang on to the fact that you're... Sorry to sound corny. You're providing hope. Yeah. If you in a world that is full of hate and fighting and it's all about money, I think what keeps me going personally, as you can say, is that you're working something very addictive about the fact that you're providing hope to people, that there is a service, there is someone out there. If your kid's got a condition that no one else is going to touch because it's expensive, and therefore my child's going to die, I think there's something that keeps you going. If you can help one child at a time, then that's really worthwhile.
Yeah, I think the same for me. I have seen, kids that have demised after, maybe during a mission. and you see the sadness that it brought. I've also seen children that the parents, you can see the desperation on their face because they would say sometimes, and when I talk to them, they would say sometimes my child turns blue. I have to leave my job because the teachers would call to say my child not getting any oxygen and I have to go and get them. So she had to leave her job to stay home just in case that call comes so she can respond. And then there is now the relief after the procedure has been done, and as Emma said, she hopes that those incidents of the child turning blue would go away. And so there is relief after the procedure that my child is going to be normal or as close to normal as possible. So it keeps you going. It just motivates you, and it hurts when you see them, them demise. But at the same time, the majority of them have been given hope. They have been given treatment. They know their child can be normal again, and you see happiness. So that keeps us going every day.
I think that's an excellent point. A family that has a sick child with congenital heart disease, and the child sometimes doesn't go to school because they can't play with their peers. They're blue. We say they're blue babies because the blood isn't going around the body, and you can literally sometimes see the fingernails and the lips are blue, and then straight after surgery they've turned pink. It's that quick, and we often give them a football because they're up and around quickly as well. So it's a really quite a rewarding turnaround that you can see that. But it's a financial burden on the families if they have a sick child, bring them back and forth across the island for appointments, not being able to go to school. It affects the whole family. So it's not just the patients, it's the whole family that you're bringing hope to.
Is there room for to make an appeal for organ donors, children organ donors, or that will be out of the loop?
We're not there yet. The service isn't there yet. The service isn't there yet. We don't do transplantations yet, but yeah. I think it's more about providing comfort for those families that feel afraid, and I understand the fear for their children.
Chain of Hope Jamaica really has been working in the background, and part of it is that we're not using the funds for a PR campaign, but we'd love to do that because we'd like to encourage corporate entities to support the work of Chain of Hope. These kids are born with the heart disease. So, and these parents are desperate. They have no other source of funding for these procedures privately. And so they rely on a chain like this, Chain of Hope, to provide that support, to provide that intervention for them. And so it is an expensive affair. It's an expensive undertaking. So if Corporate Jamaica joins with Chain of Hope Jamaica, right, joins with Chain of Hope UK to provide help, and I'm talking financial help, for us to get the disposables, forget the devices that have to be implanted. For instance, Emma talked about valves, have to be replaced. We have had to do one earlier this year. So expensive. If they join with us,
you're talking about $5,000 US for a valve.
For a
just
valve.
To give you an idea, it's nothing small.
How many valves might one patient take?
It's normally one valve, but it's not every patient, but it's
Right.
when needed. But and a surgery cost is $6,000 average for the consumables, just to give you a feel.
That's the consumables.
That's
because
without
remember, the volunteers is for free.
Yeah.
So if they help us, we can add one more child to the list, and another child.
No.
So I appeal for that.
But there was you made mention of the mother who has to stay home when the child is ill or likely to get ill. So there's also the economic impact because she might not be able to keep a job if she has to pull out of the system.
A blue baby.
Yes, exactly.
So even support in terms of that.
Correct. And that's one of the things that even our board here, we've talked about, if we could do local outreach, and I'm talking about social outreach to these children. So we do the medical, the cardiac interventions and so on, but even to give social. At the moment, we do it, but on a small scale. For instance, let me tell you how. So, for instance, bus fares. So we have a mother in St. Thomas, and she needs to come in for a procedure. She needs to come in for a consultation with the cardiologist. She doesn't have the bus fare. So what Chain of Hope Jamaica does is provide the bus fare for her. So she takes a cab or the bus borrow the money, and then she comes and we reimburse her. You know what I'm saying? We'd like to do it, help some more.
Yeah.
We have persons, as you say, as I had mentioned, that can't work, they don't work, so they don't have the means to do the blood test. So the blood test may not be available here at the hospital, so the surgeons would say, well, they need to get it outside. And Chain of Hope would provide the money for the blood test. Yesterday, for example, we had to do a thyroid function test. A child who is going to do procedure tomorrow, and then we paid for that because they had to do it outside, you know. And we do these things quietly, so we like to do more, but just we don't have the financial, money. We don't have it to do
A
that.
CT scan
A
is another
CT
example, and that's a lot more expensive, but if a child, you know, sometimes to really, if you know what kind of operation you need to do, you need really good imaging. So whilst we Chain of Hope UK have provided, together with some partners, portable echo machines for them to use. Sometimes portable echo machines, so ultrasound.
Oh.
So we'll show you afterwards. So they're very specialist machines, so you can scan the heart, but sometimes you need a CT scan to have a really thorough, or an MRI, and that's something that's not here available at Bustamante. So it's something that the patient would have to pay for. So again, if you're having an operation, if you think of it that way, or your child's having an operation, you want to have the best imaging beforehand, so that the surgeon knows exactly what the best outcome is, or if the operation is essential, sometimes you need the better imaging. So a CT scan and an MRI is a challenge, because it's a very expensive scan to get here, anywhere in the world, not just in
So we help with some, but you know, it's not possible financially to help with all of them. So that is why the appeal is so important. And corporate Jamaica, most of our leaders, they have children, and nobody you will not know that your child is sick, you know. So each one can help one.
Yeah, and we would like it to be a world here that no child has to fly overseas. You know, they raise money for a child to go overseas for treatment. We would like to build up this centre with enough equipment, enough staff that are trained, enough supplies, so that all children can be treated in Jamaica. That's really the end goal.